Hello there, my name is Artur Valerievich and I teach anatomy. And today we're gonna speak about iliac arteries, about common, external, internal arteries and femoral artery. So we begin from bifurcation of aorta. As you remember, aorta terminates between fourth and fifth lumbar vertebrae. Here is bifurcation, and it divides on two vessels, on common iliac arteries, right and left. So arteria iliaca communis dextra and arteria iliaca communis sinistra. They give no branches, but from the level of bifurcation of aorta, as you can see here, one small vessel will go down and the anterior surface of sacrum, of sacral bone. It calls arteria sacralis mediana. It supply this wall, posterior wall of pelvis, and that's all. Common iliac arteries give no branches. They go to the sides and on the level of sacroiliac joint, here articulatio sacroiliaca, it divides on two vessels, on external and internal iliac arteries, arteria iliaca externa and arteria iliaca interna. An external iliac artery go under the inguinal ligament and became like continuation of its vessel, it will be arteria femoralis. Arteria iliaca interna go down into the pelvic cavity and will give a lot of branches that will supply walls and organs of pelvis. And we will proceed with arteria iliaca interna. Internal iliac artery, arteria iliaca interna, it's short vessel that go inside pelvic cavity and will divide on a lot of branches. Also, you can divide them, like branches of aorta, on parietal and visceral branches to supply walls or organs of pelvic cavity. Parietal vessels are arteria iliolumbalis, arteria sacralis lateralis, arteria glutea superior, arteria glutea inferior, and arteria obturatoria. Visceral vessels will be arteria umbilicalis, arteria vesicalis inferioris, arteria rectalis media, and arteria pudenda inter. First one is arteria iliolumbalis, and it go up and divides here on this level on two branches, on ramus iliacus and ramus lumbalis. So here is ramus iliacus here. It go to iliac bone, and the ramus lumbalis go up and make anastomose with lumbar arteries of aorta. So iliac branch supply musculus iliacus and muscles that attach to iliac crest, ramus lumbalis. So it will supply these muscles above iliac bone. Arteria sacralis lateralis. Lateral sacral artery go here, left and right, and make anastomose with middle sacral artery and supply like posterior wall of pelvis. Next, superior and inferior gluteal artery, arteria glutea superior and inferior. So superior and inferior gluteal artery go through a supra and infrapiriformis opening. If you talk about superior, arteria glutea superior supply musculus gluteus minimus, musculus gluteus medius. It will give branches to musculus tensor fasciolata and also give branches to hip joint. Arteria glutea inferior go through infrapiriformis opening and supply musculus gluteus maximus. As you can see, also give branches to hip joint and give this small branch that come along with sciatic nerve, the biggest nerve in your body, and supply it. It calls arteria commitans nervi ischiadici. And the last one, it's arteria obturatoria. Arteria obturatoria, it's in the name. It go to canalis obturatorius, to obturatorius canal. Before it enters obturatorius canal, it gives a small branch. It calls ramus pubicus. It came to pubic bone and symphysis. It's applied and make anastomose with epigastric inferior. It go through canal and go under this musculus pectineus and divides on two branches, anterior and posterior. Ramus anterior will supply these muscles, this medial group of muscles of hip. Posterior branch will go back with this muscle that originated from membrana obturatorius, musculus obturatorius externus, supply this muscle and give this small branch here that calls ramus acetabuliaris. It enters acetabulum, it enters hip joint, articulatio cocci, remember, and it go inside this ligament. It go inside ligamentum capitis femoris that came to fovea capitis femoris and supply head of femur, caput femoris. Visceral branches. Visceral branches come to organs and supply, and we start with first. It's arteria umbilicalis. Arteria umbilicalis is a long vessel that come to umbilicus, and it actually work during fetus. In fetus, in embryological stage, it's bring blood from fetus to placenta, but after the birth is distal part, it's actually closed, but its proximal part, it's open. They call this distal part, it calls pars occlusa, closed. This proximal part, it calls pars patens, open part. Why? From this proximal part, it gives small vessels that supply superior part of vesica urinaria. They call arteria vesicalis superioris. Also from, if we talk about male, from arteria umbilicalis, there will be some rami ductus deferens that will supply ductus deferens. Next, if we have like superior vesical arteries, then we need to have inferior vesical artery. So here is arteria vesicalis inferior. That also, if we talk about male, arteria vesicalis inferior will supply prostata. Here is rami prostatice to prostata. Next one, it's arteria rectalis, but it will called arteria rectalis media. It's middle rectal arteries, arteria rectalis inferior. That will supply like middle part of rectum, ampulla. And if we will talk about female, from arteria rectalis media, there will be some branches to vagina, rami vaginalis to vagina. To continue with female, they have also one big artery that originated from iliac interna, it's arteria uterina. Big arteria uterina that come to uterus. And it's big arteries and will have a lot of branches, rami vaginalis to supply vagina, rami helicini to supply myometrium, and ramus tubaris to tube, and ramus avaricus to supply ovarium. And finally, it's like the longest artery of all this. It's arteria pudenda interna. Internal pudendal artery. It's have its long vessel that have a complex way. It's as you can see, it go out of pelvis through foramen infrapiriformis with glutea inferior. But this artery then loop around spina sciatica and come back through foramen sciaticum minus, and it's laying on fascia of musculus obturatorius internus. It covered with fascia, and it go with vein and with nerve, and it covered with this fascia, and its canal, it's called canalis pudentalis. So this pudendal artery, vein, and nerve go through the canalis pudentalis and enters perineum. And then it divides in a lot of branches. First one, it's branches that are common for female and male. They are arteria rectalis inferioris, inferior rectal artery that come to canalis analis and supply musculus sphincter ani externus internus. Then it's rami perinealis that will supply all perineal muscles. Then they will differ. Female will have arteria dorsalis and arteria profunda clitoridis and arteria labialis posterioris to supply labia pudenda major. If we will talk about male, we will have arteria dorsalis and profunda penis and arteria scrotalis posterioris. This part will be different. And now we can describe supply of rectum. Rectum, as you can see now, it have like 5 arteries, 2 paired and 1 unpaired. One that you know previously, it's arteria rectalis superior, it's unpaired, and it came from mesenterica inferior artery. Then it have 2 more pairs of arteries that came from iliaca interna. Directly from iliaca interna there will be arteria rectalis media, and from pudenda interna there will be arteria rectalis inferior. So here is supply of rectum. Then we will continue with iliaca externa. So arteria iliaca externa. Arteria iliaca externa go under the inguinal ligament, go through lacuna vasorum and became arteria femoralis. Arteria iliaca externa will give only two vessels, as you can see, two branches. So first one is arteria circumflexa ilium profundo that laying on iliac crest and will make anastomosis with ramus iliacus from ilio lumbalis and will like supply musculus iliopsoas, musculus iliacus, and the muscles that originate inserts to iliac crest. And second one is arteria epigastrica inferior here. Arteria epigastrica inferior that will give also pubic branch, ramus pubicus, that will make anastomosis with pubic branch from obturatoria. And it will go up, it enters rectus sheath, and on the level of like umbilicus, it will make anastomosis with arteria epigastrica superior from thoracica inter. Epigastrica inferior will supply like rectus sheath, musculus rectus abdominis, and also lateral muscles of abdomen. So femoral artery, it's the continuation of iliaca externa. Arteria femoralis, it's situated on the hip inside, like within trigonum, within triangle femoral, trigonum femorale, go down between muscles, between vastus medialis and adductor magnus, then enters canalis adductorius and go through canalis adductorius, then exit canalis adductorius via this hiatus adductorius and became arteria poplita. Femoral artery have like 5 main branches. One very big, arteria profunda femoris, and 4 small. So we have like 3 superficial branches. They are, so first one, it's arteria circumflexa ilium superficialis. That crosses the inguinal ligament and will supply that reach spinaliac anterior superior and will supply these muscles originated. Then it will be arteria epigastrica superficialis, also superficial epigastric artery. It also come to rectus sheath, but on anterior layer, and supply it and the rectus muscle and muscles of abdomen. And the arteria pudenda extern. We have like superficial and they're deep. Superficial come to funiculus spermaticus, supply it deep, pudenda externum profunda. It enters like scrotum and will give ramis cratalis posterioris if it's male. In female, rami labialis, supply external genital organs. This last small one branch, it's arteria descendens genus. In this place where arteria femoralis go through canalis adductoris, remember walls like vastus medialis, adductor manus, and this fascia or lamina vasta adductoria. It gives this branch that penetrate, as you can see, it go out of canal with nerve with the nervus saphenus, go down and will loop around knee joint and will end here, supply knee joint. And the biggest branch of femoral artery, it's arteria profunda femoris, like deep femoral artery. It's very big vessel that go deep between deep under the rectus, under the vastus medialis, and will give some branches. First one, it's 2 circumflex arteries, lateralis and medialis. As you can see, one of them go like to the lateral side, another will go to medial side. So it will be arteria circumflexa femoris lateralis, this circumflexa femoris medialis. So circumflexa femoris lateralis will divide, as you can see, on 3 branches: ramus ascendens, ramus transversus, ramus descendens, that will supply mostly muscles. It's quadriceps femoris and sartorius, and also ramus ascendens supply articulatio coccyx, hip joint. Circumflexa femoris medialis, loop medially, then go back, and it will have like deep and superficial branches. Anyway, most of its branches it will also supply articulatio coccyx. And then profunda femoris go down, and as you can see, give 4 perforant branches. They called rami perforantes or arteria perforantes. They penetrate arteria, they penetrate musculus adductor magnus. Here they come on back side and supply posterior group of muscles of hip. It's biceps femoris, you remember it's biceps femoris, semitendinosus, and semimembranosus muscles. So I guess that's all about this topic.